Union Mission Ministries in Norfolk, Virginia has found a new way to demonstrate the compassion of Christ while providing much-needed medical care.
I'm going to go ahead and get a listen to your heart here first. All right.
It's in the form of a permanent doctor's office in their shelter to help men, women, and children who are homeless.
This is a great place. It really is.
To say it's very important is a gross understatement.
The idea is to follow Christ's model by meeting people in their moment of extreme need.
God created us, one, to worship him in spirit and truth. He also created us not to be on an island amongst ourselves, that we are created to be in fellowship with one another, that we were created to be in community.
Regardless of their ability to pay, people staying at the shelter now have access to a primary care physician.
Our goal why we got into medicine is not just to take care of their blood pressure and their diabetes, but we do that. We take care of all their problems that they have, their medical problems. But you get to know the patients, too.
The ministry partnered with Sentara Healthcare's new program to reach people who can't get the medical attention they need.
My place of home when I want to do things after work and with my family is my church. So it was a no-brainer to me to think, you know what? Maybe the way that we really can get to the community members that are not receiving care is through other avenues. And the faith-based and the church locations was our #1 go-to.
It's only what you have done for Christ that will last.
That's what makes Reverend Jeffrey Guns the perfect partner, as he's in the middle of one of Norfolk's neediest communities.
One of the things that is often not understood or overlooked about black churches is that we are very much concerned about the physical well-being as well as the spiritual, because it's no use to talk to people about going to heaven when you're living in hell.
Guns points out how underserved populations rarely have transportation or enough time to go to the doctor. Affordability and lack of trust can also keep folks away.
In the healthcare industry, you have to have people who are willing to work with you, and then who are willing to stay the course, and who are willing to say, you tell us what you need. You tell us how to do this. You tell us and help us to understand how to work in these communities. Because everybody doesn't understand how to do that.
That willingness added a resource to the one at the homeless shelter as another permanent clinic opened in a highly vulnerable area.
We're being innovative, and most of all, we are listening.
And as a way to serve countless others, this doctor's office on wheels travels to different neighborhoods, often parking in front of familiar churches. This mobile clinic is as much like a regular doctor's office as possible. There are exam rooms, a place to draw blood, give immunizations, and even privacy to discuss mental health issues. All patients are welcome regardless of their insurance status.
And we can't build brick and mortar everywhere. So having this van and be able to put the van in a certain area like Queen Street Baptist Church or Ivy Baptist or Good Samaritan and have it go back on a weekly basis, patients can get used to coming back, and that can be their mobile medical home.
It's an effort to move from health equality to health equity.
So you think equality, I'm giving everyone the same resource, right? When I think equity, what I'm going to do is I'm going to individualize that. So for example, I could have 2 chairs in here, and they're the chairs like you and I are sitting on. Well, if it's someone who needs a wheelchair, I have provided equality because I brought in 2 chairs. It wasn't equitable because one person could not utilize that chair.
So while healthcare might be available to all, certain populations are unable or unwilling to take advantage due to special circumstances. In those cases, some Christian ministries are working with healthcare providers to meet these underserved communities where they are.
Showing compassion, showing empathy, showing Christ-like love, and what that can do, and if we withhold that, what that also can do. And just understanding the weight of that, we all have the capacity to serve in a way that enhances the quality of life of people around us.
Lorie Johnson, CBN News.